Hi, my name is Jennifer Pierre. I'm a nurse practitioner student at Maryville University, and I'm going to be doing my head-to-toe assessment today. This is my ID, okay? And we're just going to do a 360 of the room. And this is my volunteer patient today for my head-to-toe examination. So the patient has already emptied his bladder, and for demonstration purposes, just because this is educational and stuff, he's not going to wear a gown, but this is going to be his gown, and for privacy purposes as well. We're also going to do his height and weight. We did that, and just take his vitals, which is, the blood pressure and the respirations and everything. So we're going to do that really quick. Pick your arm up for me. This is not right. Okay. And put it on over here. Relax your arm. All right, 110/70. Very good. All right. So the blood pressure is good. We're just gonna check his pulse as well. All right, good. So his pulse is good. It's about 80s, and his respirations are 20. And with the vitals, we also check the temperature. I'm just going to check his temperature across his forehead here. Okay, that's good. 96. He's 97.6. He's afebrile. So the first thing I'm going to do with my assessment, I'm just going to take a look at his head, make sure that's all it's symmetrical. There's no problems there. Take a look at his facial expressions, cranial nerve number 7. I'm just going to have you puff your cheeks out like a blowfish. And then I'm going to have you smile. And then frown. And then clench your eyes really tight. Okay? And then clench your jaws really tight for me. And with this, I'm just going to check his area here just to make sure, look for muscle tone. You can stop. And just check for muscle tone and everything. Okay? The next thing I'm also going to do is just check his temporomandibular area here, okay, and that's fine. Next, gonna just palpate his head, make sure there's no nodules or anything like that I should know about, and also his sinus, his frontal sinus, his sphenoid and his ethmoid and sphenoid sinus, and then his maxillary sinus, make sure there's no tenderness there. As well as palpating his facial bone and structures. Okay, and making sure there's no abnormalities. The next thing I'm going to do is take a look at his eyes and just make sure there's no drooping or anything of his eyes. Make sure there's no drainage. I'm going to make sure there's no periorbital edema. I'm going to check his conjunctiva, his sclera, and that looks good. Make sure there's no pallor, and also palpate that lacrimal apparatus there. And the next thing we're going to do is just check for light reflex. We're going to look for accommodation as well as consensual response. If you could just look straight ahead for me. Okay. Good. All right, and that looks good. You okay? Mm-hmm. All right. And then we're going to, it's going to go off. All right, and then we're going to just check for the red reflex as well. And look straight ahead for me. Okay, good, red reflex there. Oops, sorry. Okay, good red reflex there. And then I'm just going to go in and just take a look at his optic nerve, okay, while I'm here. His optic disc, I meant, not his optic nerve. Keep saying like optic nerve. Okay, all right. The next thing I'm going to do is, and with the optic nerve, I'm just looking for the borders and making sure that the venous pattern is good. The next thing we're going to do is the cover-uncover test, okay, and just checking for strabismus, okay. So I'm going to have you look at this object when I cover your eye, okay. Then this one, okay, good. And we're going to look at the extraocular eye movements as well. Okay, and a lot of this has to do with the cranial nerves, cranial nerve 3, 4, and 6. So I'm just going to have you look at this object and you're going to just follow it with your eyes. Okay? Okay. Okay, and that can check for astigmatism. So we did that, light reflex, we looked at your pupillary response. So next we're going to check your, we're going to look at your ears, okay, and the ears are symmetrical, they're lining up with the eyes, just feeling his auricle of the ear, and that looks good. We're going to do the whisper test. I'm just going to have you occlude one of your ears, your right ear, okay, and I'm just going to stand behind you, I'm going to whisper 3 things, I'm just going to have you repeat, okay, 77. 77,
77,
88,
88,
90.
90.
Okay, and cover your other ear. A,
8,
B,
B,
D.
D.
Okay, good. All right. The next test, I'm gonna check for bone and air conduction with the ears. First, I'm gonna do the Weber test. With the Weber test, I'm gonna put the tuning fork on top of your head. You're gonna let me know if you hear it in both ears or one ear.
One ear.
So with the Weber test, you're usually supposed to hear it in both ears, so of course I would have to investigate that further. Okay, so the Rene test is going to be bone conduction and air conduction behind the ear. Okay, so just tell me when you stop hearing the sound.
Okay. Okay.
All right. And we're going to do the other ear.
Okay. Okay.
Okay, and that is the Rene test, okay? The next thing I'm going to do is take the otoscope and I'm going to take a look inside the patient's ear and we'll look at the tympanic membrane, make sure it's pearly gray. If there's any problems, of course, have them referred, okay? I'll turn the light on first. I'm trying to see something. Okay. And the next one I'm going to take a look at here. Okay, good. All right, so the ears look pretty good there. We're just, like I said, looking at the tympanic membrane. And so after that, what we're going to do is look at the nose. The nose is midline. And we're going to just look at the septum. It looks good. And I'm just going to occlude one of your ears and you're just going to blow out for me a little bit. Okay? Just check for patency of the ears. Okay? And then I'm going to also look in the ears. This is what I forgot last time. So we're going to look in the ears. Just relax. And we're looking at the inferior turbinates, nasal mucosa, and the septum. Make sure the nasal mucosa is nice and pink. Okay, that looks good. Take a tissue. Take that off. All right. So the nasal mucosa looks good. It's nice and pink. We don't want to see any purulent drainage or anything like that. Next thing we're going to do is look in the mouth. If you can open your mouth for me, we're going to look at the hard palate, the soft palate, the floor of the mouth, the tongue. You can stick your tongue out. Move it side to side for me. Okay, good. Say ah. Okay, and we're looking at the uvula. You can close your mouth. Anterior, posterior pillars were there. Open your mouth again for me. Okay, and the say ah again. Okay, the tonsils are present. They're not swollen or anything. You don't want any swelling in the tonsils. And the buccal mucosa was nice and pink. Teeth present. No signs of infection or anything like that. And also the gums look good in his mouth. And lips are not pale or anything like that. There's no pallor, which would be a sign of central cyanosis. Okay. I'm also going to do a gag reflex, which is cranial nerve number 10, the vagus nerve. Okay. He has a good gag reflex. So that sounds good. There's no odor in the breath that I should be concerned about or anything. And so the next thing that we're going to do is look at your neck. Just looking at the trachea, make sure it's midline, and then make sure there's no swelling with the thyroid or anything. Next, I'm going to palpate the trachea and the thyroid. Can you swallow for me? Okay, there's no swelling in the thyroid at all. I'm also going to palpate the carotid pulses. Okay, and those are present. The next thing I'm going to palpate is his nodes, okay? His lymph nodes, the occipital nodes, the posterior cervical chain, the superficial cervical chain, and then the deep cervical chain, okay? The post-auricle, the pre-auricle nodes, and we're just looking for any swelling. The tonsillar nodes, the submandibular nodes, and the submental nodes. Okay, and then the supraclavicular nodes. Okay, and I don't feel any swelling or anything like that with the nodes. The next thing I'm going to do is auscultate the carotid and the thyroid. I definitely don't want to hear any bruit with the thyroid, which would be indicative of hyperthyroidism. Okay, and then the carotid. Okay, I don't hear any bruits or anything like that. Okay, so with that, I'm going to also next look at his upper extremities. I'm just going to have you shrug your shoulders. Just shrug your shoulders. Just shrug. Don't breathe. Just shrug. Okay, good. And then with that, we're looking for asymmetry or any, that's good. And then, or any atrophy or anything like that. And it looks like everything is symmetrical. Just checking for muscle tone as well. I'm going to check the fingers for capillary refill. I'm just going to have you squeeze my hands for me. And just checking for muscle strength. Okay, and if you can, I'm just going to check also the radial pulses. And then the carotid pulse. I mean, not the carotid, the brachial pulses. Good. Good. The skin is nice and warm. I don't see any discoloration on the skin for the arms. If you could put your arms out to the side for me, and then push up on my arm. Good. Good muscle strength. Push down. Good. All right, and just put your arms above your head for me. Okay, good. And then bring them down. Okay, good. Good range of motion with his arms. The next thing I'm going to look at is the posterior chest wall. I'm going to have you turn around to Chris for me. Okay, and we're going to look at the costovertebral angle and just palpate there. Make sure there's no tenderness there. And then we're also going to percuss too. Okay, make sure there's no tenderness, which could be a sign of kidney infection. Okay, you can turn back around for me. All right. After that, we're gonna look at the lungs. Okay, and oh, you know what? Turn back around that way. I'm sorry. We're gonna percuss. We're gonna palpate first for expansion. So hold on. Take a deep breath for me. Good. Okay. So, and then tactile from it, because every time I touch your chest, say 99.
99, 99, 99, 99.
Okay. Good. So that's the tactile primitive. And the next we're gonna percuss the chest wall. All right. And you can turn back around for me. Okay. All right. And the next thing we're gonna do is percuss for diaphragmatic excursion. Okay. And I'm gonna have you breathe in for me. We're gonna. Okay. And you can breathe normally. We're gonna use tape just for this demonstration. Breathe normally. You are? Okay. All right. And then I'm gonna have you exhale and hold it. Exhale and hold it. Okay. Good. Good. All right. Very good. And we're just gonna measure that. Okay. All right. Oops. All right. And that's about 5 centimeters there, which is good. Okay. All right. So after we percuss that, we're going to listen to the. We're going to listen to the chest wall. Okay. Just lung sounds. Take a deep breath. In and out. 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 Good. Good. Sit up for me. We're gonna listen to the back. In and out. In and out. Okay, good. All right, and also with respirations, we're going to make sure when we're assessing him and inspecting that he's not having any difficulty breathing, or you don't see him using any accessory muscles or anything like that, which would be indicative of difficulty breathing. Next, we're going to look at the heart and the lungs together too. First, with the heart, we just want to make sure that he's not having any chest pain or anything like that. And of course, we did a history before, and he's denying that. And he's not diaphoretic or anything, which would be a sign of some heart problems or some pain. So first we're going to palpate after we inspect. Okay, I'm going to palpate the pericardium and the apex, and we're just checking for any heaves or lifts, the left sternal border, and then the base. And like I said, checking for any heaves or lifts. And we're next going to palpate the PMI, the point of maximum impulse. Okay, and next we are going to listen at all the areas, the aortic area, the pulmonic area, the tricuspid area, the second tricuspid area, and then the mitral valve area. And then we're going to also listen to Erb's point in the third intercostal space. And again, we're listening for any murmurs or any thing like that. So that's it with the heart. Next, we're gonna look at the abdomen. We're gonna for the abdomen, we're going to auscultate first. Okay. And I'm gonna have you lay down for the abdomen. I'm sorry. Just move all my stuff out of the way. Okay, so we're gonna auscultate the abdomen first. Okay. This is his belly button, so the right lower quadrant, right upper. He has great vowel sounds. Okay, and then we're also gonna auscultate. This is the belly button, the aorta. to make sure that there's no thrills or anything like that, or bruise. I'm sorry. We're gonna auscultate the renal arteries, then the iliac arteries, and just checking for bruise and the femoral artery. Okay. The next thing that we're going to do with the abdomen is we're going to percuss. You want to hear timpani? Okay. And we're also going to percuss for the spleen. The liver. I'm sorry, liver border. Okay. And then it's the liver border there, and then the splenic dullness. Okay. And then we're just going to do light palpation. Okay. And then some deep palpation. Sorry. Okay. And then we're just going to assess see if we feel that liver there and that right side. Okay. As well as the spleen. Okay. Then with the abdomen, let's go with the abdomen. Percuss, auscultate, palpate. So then we're gonna take a look at the legs. We're gonna look at the hair on the legs, making sure it's normal hair distribution, temperatures nice and warm. We're looking at capillary refill for the feet. Okay. Can you press against my hand? Okay, and press up. Okay. We're just looking for muscle strength there. Checking for pedal pulses. Okay, and then the popliteal pulse. Relax. Okay, all right, and then we're checking for edema too, making sure that there's no edema, which would be indicative of like a blood clot or something like that. You can come sit back in the chair for me, okay? And so with the legs, and then after the legs, we're going to look at the neurological. We did most of the cranial nerves, 1 through 12, like the optic, the olfactory would be cranial nerve number 1, which because of demonstration purposes, we're not going to do, or educational purposes, we're not going to do that right now. We're going to do the test of sensation for the nerves, and you're just going to let me know if you what you feel, okay? And you're just going to close your eyes and just let me know if you feel a sharp sensation or soft sensation and where.
Sharp on the hand.
Okay.
Sharp on the arm.
Okay.
Sharp on the right leg.
Mm-hmm.
Sharp on the top of the hand. Soft.
Mm-hmm.
Soft.
Okay.
Sharp.
On the where?
Stomach.
Okay. All right. So that's the sensation there for the cranial nerves. Next, I'm going to go into musculoskeletal, and we're going to look at reflexes. Where's my hammer? Okay. Good. So we're going to look at reflexes. First, we're going to look at the brachial reflex. And just relax your arm for me. Okay. Okay, we're going to look at the brachial, then we're going to look at the knee. Relax. Okay. And then we're going to look at the, do the Achilles tendon reflex. Okay. And the feet, like I said, I tested the muscles in the feet and everything. We're also going to have you do the cervical. And I'm gonna have you put your head to the side, and the other side, down, and then back. Okay, and that looks good. And if you can stand up for me, okay, and then just touch your toes, bend down. Touch your toes. Well, you don't have to touch your toes. Just bend a little bit. That's good. We're just gonna make sure the spine is midline. Make sure there's no any tenderness or anything like that in the spine. There, you can sit down for me. All right, and I think that is about it. So that's going to be the end of my head to toe examination. Thank you for listening.